afternoon, Selamat Sore. This is my no-name channel. I'm Bruce, and this is another Bali COVID-19 update for July 18th, 2021. And unfortunately, another week of not so good news. If you were looking for something less depressing, you could take a look at my video that I posted the other day, a drone flight at night. But today is not going to be good news, unfortunately. Let's start with the numbers. Record number of cases yesterday in Bali, 1,019. Yes, we passed the 1,000 mark. It's hard to believe that we were at 22 at one point not that long ago. That makes the 7-day moving average 773 cases. And in Indonesia as a whole, yesterday was 51,952 cases, so down from record numbers on Thursday, but still well above 50,000. And the vaccination numbers here, 2,889,957, or 67% of the population for first dose. Second dose is 776,688, or 18% of the population. 27,294 doses were administered yesterday. Okay, and so new cases 1,019, recoveries 529, deaths 23. Yeah, we're up to 23 deaths a day. We were at 2 not too long ago. And active cases 6,652. Okay, numbers are not looking good at all. Of the 1,019 new cases, all of them were Indonesians, no new cases of foreigners. And again, people question these numbers on foreigners. When you take a look at Jackie Pomeroy's COVID-19 Facebook page, for example, people say, well, my friend had it, or I had it, and it went, but the numbers never showed up. I don't know what's happening with the foreigner numbers, and nobody does. Okay, so out of those, 854 are local transmissions, 164 from domestic travelers, and 1 case from international travel. And the new cases, 388 in Denpasar, 185 in Badung, 114 in Tabanan, Buleleng 106, Gianyar 86, Karangasem 39, Jembrana 38, Bangli 28, Klungkung 23. Well, okay. So I've changed the way that I, again, put numbers up. I've taken off the total number of cases, because what's the point? It just keeps going up. I'm going to stick to daily numbers for now. Okay, so the numbers don't look good. Now, if you're here, or if you've been following things, or if you've been following my channel, you know that we're in emergency lockdown, and it's scheduled to end on Tuesday, the 20th. And first, there's going to be this report that I did, segment on the lockdown, what happened 2 days ago. And then I'm going to do one right now, a new one that just came out. It's a case of the left hand doesn't seem to know what the right hand is doing. So this is July 18th. We only have a couple more days of the emergency restrictions. Well, I'm recording this actually on the, what is this? The 14th, so we still got 6 more days but by the time I upload this, it will be the 18th, and there will be only 2 more days. But the Minister of Finance, Sri Mulyani, has been floating the idea that the emergency restrictions could be extended for up to 6 weeks due to the high risk posed by the Delta variant. She said the government's view is that the emergency restrictions need to be effective and the vaccination process needs to be accelerated in order to get the economy back rolling again. According to the minister, an extension of the restrictions should significantly reduce community mobility and allow the government and healthcare workers to get control of the virus, which as of today was up over 40,000. Nationally, I think 85% of that is in Java, and in Bali we had 650, 670, so nothing's going down yet. And the minister also said that projections for economic growth for the rest of the year should be anywhere between 3.7 and 4.5%, she said, while Bank Indonesia governor projected 3.8%. Both estimates are lower than the earlier estimates of 4.6%. And that's taking into account where we are right now. If the restrictions are extended for 6 weeks, yeah, the economy is gonna take another hit. So the big story this week is the extension of the emergency restrictions. Everybody's been waiting to see what was going to happen, as the 20th was supposed to be the end, and it has been announced that the restrictions will continue until the end of July. According to a report in Antara News, the coordinating minister for human development and culture, Pak Effendi, said that the president during a limited cabinet meeting decided to extend the emergency restrictions until the end of July. And this ends all the talk about what's going to happen. According to Effendi, the president said there were a lot of risks involved in extending the restrictions, including how to balance between disciplining residents on obeying the health protocols, because this has been a problem, with the distribution of social assistance. And on this critical issue of social assistance, the president said that it can't rely solely on the central government, but has to be a mutual cooperation with the communities and other agencies. He noted that the donation of masks is an important issue because many people consider it too expensive to buy masks, and so need to be prepared to give people masks. And additionally, he said, whatever term is used to describe the new restrictions, whether it's emergency PPKM or super emergency PPKM, it will not succeed if the community will not compromise and follow health protocols. And this is a message we've heard from government officials throughout the pandemic, is you have to follow health protocols. There's a lot of misinformation around, people not wanting to get vaccinated, people not wanting to wear masks, social distancing, as I've said before many times, difficult for Indonesians. Just taking a look at Jalan Diponegoro, the main road here, Jalan Ayani, you look there, almost everybody has a mask on, 99%. Of course, you have some nose wears, some chin wears, but people have their mask. However, if you go into the kampungs, you see a different story. I was asking a person that I know the other day about how come they don't wear masks in the kampung. Nobody's sick here, so what's the point? It's not like when we're outside. There may be people sick out there. And I said, plus there's policemen. Yeah, and then there's people watching and monitoring us. And here in the neighborhoods, there's not. And so that's one of the problems that the government is up against. PPKM extended until what date? This is the government's official answer. So as I said in my previous segment, this is the big question. And generally, emergency lockdown has not been popular. There's been pushback from businesses here in Bali. And you'll see a report on that. These are from businesses that are considered non-essential, but they tell people authorities when they come to tell them why close down, hey, what are we supposed to do to eat? And there's uneven implementation of travel restrictions, uneven implementation of shop closures, restaurant openings. So the enforcement, the implementation, the enforcement is not even across the board, which just creates more complaints about this. So, when the previous announcement hit the news, they just talked about, many people assumed that the emergency restrictions would be extended because, well, this was a minister quoting the president. But today, Pak Luhut, the coordinating minister for Maritime Affairs and Investments, said that the decision to extend the emergency PPKM would not be made today. It would be submitted in the next 2 to 3 days, which means, he said that yesterday, so that means Monday or Tuesday. He said, currently we are evaluating whether the PPKM with this time period needs to be further extended. We will report the evaluation results to the President, and I think in the next 2 to 3 days we'll also officially announce what's going to happen. He rationalizes non-decision by saying that 2 factors need to be considered. First, the number of additional new cases of COVID-19, and the second is the utilization rate of hospital beds, or the bed occupancy rate, or BORs, I've talked about before. Did not mention the comments yesterday about the president, what the president said, according to Pak Effendi. So Pak Luhut said that restrictions could be eased up if the indicators are positive. He continued that the decline in mobility was not immediately had not immediately shown up in the numbers because it takes 14 to 21 days for virus transmission to be for the incubation period. And the Delta variant has a transmission rate, according to Pak Luhut, of 7 times higher than the previous variant. Meanwhile, he said the permanent solution for handling the pandemic is sticking with the strict health protocols and accelerating the vaccination program to create herd immunity. Magic herd immunity again. And he ended with, therefore, I sincerely ask for cooperation from all components of society to comply with health protocols and additional provisions during this PPKM period and to follow the vaccination program run by the government. And he apologized if the government was not implementing the emergency PPKM in the best way possible. And so, this is a non-decision. What about what Pak Effendi said? Maybe this was another trial balloon, like the one from the finance minister before. Pak Jokowi does not seem to be able to make a decision right now on what's happening. And so, we're all just going to have to wait for another 2 to 3 days to see what's happening. And what about shop closures? We're going to talk about that, but I did a quick run to the supermarket with Zoe, and you can see on this video that the majority of shops are closed. There are some that are open. It seems like all the building supply shops are open, and I guess they consider that to be essential. You could get that reading if you looked at the restrictions. And some other shops, some hand phone shops are open, and we've gone through this why the hand phone shops open, and of course mini markets, convenience stores, and the supermarket Carrefour, and the apotheques. Have the emergency restrictions stopped people from getting out and around? The streets are relatively packed with people shopping down by the market. There's still people out moving around, so I don't know. On the road, yes, there's people on the road too. But to be honest, the traffic is not as heavy as usual. So maybe this is having an effect in that sense. And so what does the president say about this? Well, in this article down below, the president said, this is a question for the community. One important thing that we need to answer is, will the emergency PPKM be extended or not? If you want to extend it, how long? This is really a sensitive matter. It must be decided with clear thought. Don't make a mistake. Will the fact that Bali has record numbers now influence this at all? Or that Jakarta is still at 50,000, still over 50,000 a day? I don't know. We'll just have to see what the president's going to decide. So while Bali and Java are uncertain about whether we're going to ease restrictions, apparently England is going to drop most of their pandemic restrictions on Monday. And according to scientists, 1,200 scientists, it's a danger. So Boris Johnson's planning on getting rid of virtually all of the restrictions in the UK on Monday. And according to world experts and governments, this is a threat to the world. Why? Because according to scientists, opening this up leads to a chance for the virus to develop vaccine-resistant variants, and because of the UK's position as a travel hub, if these develop there, they'll easily spread to the rest of the world quickly. Government advisors in New Zealand, Italy, and Israel were among those who were upset by this policy. A medical researcher from the U.S. Is afraid that this is going to set an example for states in the U.S. And if you've been following the U.S., and a lot of people say, look, the U.S., baseball's going on, people are there, no problem. Lots of people gathering, not wearing masks. Numbers are rising in states that are where residents are refusing to get vaccinated. And that's the news there, and I'm not going to go into it. You can easily find out about that, but that does not look good for the U.S. A clinical epidemiologist and senior lecturer at Queen Mary University of London said, let's be under no illusions. We are in a country where our government is taking steps to maximally expose our young to a virus that causes chronic illnesses in many. Our government is ending all protections for our children, including isolation of contacts, of cases in schools and bubbles. So what's happening in the UK is being roundly criticized by our leading scientists and governments around the world. We'll have to see what's going to happen there, and how is that going to affect President Jokowi and his decisions on what we're going to do in Indonesia. I don't know, we'll just have to see. So the numbers at 50,000 every day recently, 54,000 on Saturday, 54,000 or 55,000 the day before. And here in Bali, we're setting record numbers. So what about the future? Well, Indonesia sets plan to face 100,000 COVID-19 daily cases. So Pak Luhut, and we know who Pak Luhut is, said that the government has prepared for the worst case scenario of reaching 100,000 new cases daily, although they're hoping to keep it under 60. And what are those preparations? Well, they include accelerated mass vaccinations. Adding more hospital beds is a big need right now, especially in Java. Boosting the number of healthcare workers. And so they're graduating classes of nurses and doctors, and they're being recruited directly into the struggle against COVID-19. Medicinal needs will be fulfilled. The government is committed to supplying therapeutic medicines to people that are ill. Distributing free medicine packages to the public. Boosting the oxygen capacity and the use of oxygen concentrators. Donations from the private sector. And the rice assistance program, the government plans to distribute 11,000 tons of rice and allocate 10 kilograms to each household throughout Java and Bali during the emergency PPKM period. What is the government doing with people that test positive for COVID-19? Well, in the past they've been put in facilities run by the government, and or they've been able to self-isolate. Well, according to Bali's governor, that's no longer going to happen. But in the next segment, there seems to be a contradiction about what's going on in Buleleng, and well, we'll get to that in a minute. So people that are affected by the virus aren't going to be allowed to self-isolate at home anymore, nor will they be housed in hotels managed and paid for by the regional government, according to Governor Koster. So he said that this has come about through a joint decision from a number of organizations, which includes the Udayana military commander, the Bali police chief, and the Attorney General's office. And this new policy is called source-based quarantine. What is source-based quarantine? Well, government employees are going to be housed in facilities organized by their department. Costs for the necessities of life are going to be paid for by them because the governor said, well, they're working from home, they've got a salary, so they can pay for all the things that they need while they're in quarantine. And for those people that are not working for the government, residents at a village level are going to be the responsibility of the village, the Kelurahan, and the task force of volunteers at those levels. And they are going to provide a place for quarantine. The governor said that it could be an empty school because schools are supposed to be closed. So it could be an empty school or any building that is owned by the village or local government. And the necessities of life, such as mattresses, food, will be prepared independently by the Gotong Royong task force, village volunteers, or the families of the infected. They may bring these requirements, these necessities of life to the quarantine place, but they may not enter. So they can prepare the food, they can get drinks, but the health workers are going to have to administer this, give it to them. He said, and I quote, "If there are citizens who are affected by COVID, they would no longer be taken to quarantine at hotels carried out by the district city government. Solve it yourself. No more isolation or self-quarantine at home. It is strictly prohibited." Strictly prohibited. And the governor said that self-isolation is prohibited because he believes that the Delta variant has entered Bali and it spreads quicker and is more dangerous than the other variants that have been here so far, and so he's changed the policy. Well, he, in coordination with other government leaders. Now, what's happening in Buleleng in this regard? What's the regent doing here? We'll get to that in just a second. And what about vaccines? Well, first segment. Jokowi optimistic herd immunity to be reached in Jakarta and Bali by August. So President Jokowi is asking for the intensification of the COVID-19 vaccination in 3 provinces, West Java, Central Java, and Banten. He said that the percentage of inoculation in those 3 provinces was still low, 12% in West Java, 14% in Central Java, and so he wants to speed this up so that Java gets herd immunity, and of course Bali too. According to this article, Bali's vaccination rate is 81%, but as you saw in the numbers, there's different numbers based on the government. So the numbers that come up in some of these articles, I'm not sure where they get them from. In fact, this article has another surprising number at the end of it, and well, I'm not even going to discuss it because it doesn't fit with any of the other numbers. President Jokowi thinks that the acceleration is going to bring herd immunity by August to Java and Bali. I don't know, if we're taking herd immunity being double dose, that's going to be iffy here. If we're going to stick with the 12 weeks, and I have another, what's today, 18th? I have another 13 days before my second dose, which is July 31st. My wife's is in August, my son's in September, my other children that have just been vaccinated, they've got another 3 months to go. So, and there's still people that are not vaccinated here. The government here is continuing to vaccinate people, as you saw in the numbers, 27,000 yesterday. So the vaccination is ongoing here, especially with young people. So with vaccination still ongoing, what about the vaccine? Now, everybody's been getting Sinovac or Sinovac. Somebody told me it's Sinovac. I like Sinovac. And AstraZeneca, which I had. Well, the Moderna vaccine has arrived in Indonesia, and it's being put as a priority for healthcare workers. So a total of 3,060,000 doses of Moderna from the United States arrived in Indonesia on Sunday, last Sunday, not this Sunday. And the vaccine was sent by the U.S. through the COVAX facility. The Moderna vaccine is a mRNA-based vaccine, and it's received emergency use authorization from the government on July 2nd. The vaccine is being prioritized as a booster or a third shot for healthcare workers. If any additional vaccine is left, that can be used for people who need a first or second dose. So far, the government has received over 120 million doses of vaccine. In addition to obtaining millions of doses of vaccine through commercial procurement channels, we've also had offers of support coming from a variety of countries such as the US, Netherlands, England, Australia, the UAE, and Japan. And we're not just getting vaccines, we're also getting equipment. So some of the equipment that we've got from our neighbors in Australia and Singapore include ventilators, oxygen concentrators, medicines, and other medical equipment. So Indonesia is taking all the help it can get while we're in this crisis. U.S. Senator Duckworth announced the U.S. shipment of 1.5 million doses of the Moderna vaccine as the Biden administration ramps up vaccine diplomacy. As I mentioned previously, Indonesia is continuing to receive vaccine shipments from several countries. The U.S. sent an additional 1.5 million doses, added to the 3 million that I already sent. Senator Duckworth commented on the donations. "I'm so pleased to announce today the United States is sending 1.5 million American vaccine doses to Indonesia as the nation faces a tragic surge in COVID cases and deaths. These American vaccine will supplement the 3 million doses we sent last week, and they come with no strings attached." Okay. But rather with the knowledge that no nation can be completely safe in COVID-19 until all nations are, so we have to work together to save lives and help bring an end to this awful pandemic everywhere. And so, no strings attached, but looks like the U.S. and China are in a race to see who can give away the most doses in their rush for supremacy in what's turning out to be the next Cold War. In addition to the vaccine, the U.S. has also donated COVID testing equipment, 1,000 ventilators, 2,000 hand washing stations, and a variety of other types of assistance. So, thanks to the U.S. So, 50 million doses of Pfizer vaccine will be received by Indonesia. The Ministry of Health, along with PT Pfizer Indonesia, agreed to cooperate to provide 50 million doses of the Pfizer vaccine called BNT162b2 throughout this year, 2021. This vaccine is one of the COVID-19 vaccines being used for the accelerated vaccination program in Indonesia. And if you remember, I've discussed this before, Pak Jokowi wants to hit 1 million vaccinations a day this month, with hopes to do 2 million in August. The Indonesian government announced that they've increased the national COVID-19 vaccination target from the initial 181.5 million to 208,265,720. That's pretty specific. This covers the 12 to 17 age group that is currently being vaccinated around the country. According to Communications and Informatics Ministry spokesperson Dedi Pramati, the increased target is part of the government's attempt to achieve herd immunity to break the chain of COVID-19 transmissions. And it's also in line with the additional COVID vaccines that are continuing to arrive in Indonesia. In addition to the Moderna vaccines, Dedi announced 3.4 million doses of AstraZeneca from the COVAX movement. Dedi said, in this 1 week alone, we will see the arrival of 5 vaccines, 5 different brands of vaccines from various sources. So, as I've said, vaccinations are still ongoing. According to this article below in Radar Bali, 85% of the total of 3 million people have received stage 1 vaccinations and 25% have received stage 2. I'm not exactly sure in those figures. I'll see if I can find some complete up-to-date ones by Sunday when I post this. So I've discussed this before, but the governor has brought this up again this week. The governor has instructed village and neighborhood leaders to record residents who are eligible for vaccinations but have not yet been vaccinated. Well, that part I hadn't seen before. I didn't know that they were. I hadn't seen him say, go out and check on people and write down who has and who hasn't been vaccinated. He said the non-vaccinated should be immediately vaccinated, but that if they refuse, they should be denied government services. And I quote, I ask all local staff, village heads, and traditional village heads, if there are residents who meet the requirements but don't want to be vaccinated, don't serve their needs. If they need anything at the office, don't serve them. Additionally, he added, no one should be influenced by hoaxes, that vaccines are dangerous and not true. We have vaccinated more than 2 million people. No one's died from the vaccine. No one has gotten sick from the vaccine, he claimed. Well, a lot of people have gotten sick from the vaccine. I don't know about, I haven't heard any deaths, but I was sick, not terribly sick. And right now, 2 of my children who got vaccinated late, yesterday, day before yesterday, are not feeling really well either. In fact, they're having a harder time at it than my wife and I had when we got vaccinated. I was sick for a day. My wife was almost not sick, a little sore. The governor did admit that some people who have been vaccinated have tested positive, but he said the symptoms are less severe, the chances of getting the virus are reduced, true, and people are protected from dying from the disease. Right, so he said there's no reason not to get vaccinated, and I support that wholeheartedly. What about here and local businesses? So I talked last week and had a little video clip at the end of Zoe and I walking around, and places were still open, but that was on Sunday and it was the first day, and the socialization process had not gone through yet, and people weren't being fined, they weren't having their places closed. So things are a little different now. Socialization process has been ongoing. As I mentioned, some of the businesses may not have been aware of the new changes because there were changes in the policy, or they didn't understand what was an essential business and what isn't an essential business. So in order to properly implement the emergency community activity restriction, the Buleleng government, in cooperation with the police and the military, has begun carrying out socialization. And apparently this is still ongoing, as you'll see in this next segment. And according to the government, we hope that the public can understand the changes in the Regency's SE in this emergency PPKM, so that when we carry out our duties, unwanted things will not happen. Well, unfortunately for them, unwanted things do happen. Next segment. So after a few days of socialization, there's still some confusion about what can and what can't be opened. Officials from a variety of governmental organizations, such as TNE, the police, and others, have been checking on businesses that continue to be open even though they should be considered non-essential. members of the joint team have had some confrontations with business owners, as you see in this photo, about whether or not they are, in fact, non-essential or essential. And so in the story that's down below, in this case they went to a repair and modification workshop on Ayani. I know where the shop is. I pass it all the time. And the owner said, look, we've closed all that down. We're just open here to pump up people's tires and do some quick repairs. And so we're not really open. Well, when he got heated about it, they decided just to leave, according to this. And then they were at a cell phone business up on Jalan Udayana, up where one of the universities is. And the cell phone business operator insisted that his business was essential based on the SE from the central government, because he said he provides telecommunications access, and so he shouldn't be required to close. He insisted that based on the rules from the central government, he could stay open, and that the rules were being interpreted differently in Bali, and that they shouldn't be, and that socialization needs to be clearly explained before any actions are taken on closing businesses or fining people. And so this is Wednesday when I'm recording this, and there are more and more businesses closed, but still a few open. And tomorrow I'm going to take a walk and see what's open and what's not down in Jalan Diponegoro. Okay, so are people following the rules? Are they following the emergency restrictions? Which is no eating, no dining in, close your businesses, reduce mobility, no traveling from regency to regency. Well, first story about this is Orbit Bali Eat and Dance, this is a restaurant, held private party during emergency PPKM in Badung and penalized by 1 million rupiah fine. So a restaurant in the Umulas Kangen neighborhood, Probokan, was visited by authorities this last week. Were they looking for a good meal? No. They were reacting to a social media post inviting people to come for a party. How clueless are these people? Don't they understand that social media is being monitored? So when officers from the Joint Team for Enforcement of Community Activity Restrictions showed up to see what was going on, management said nothing's going on, there's nobody here. Everything's cool. But, not to be fooled, the officers decided to come in and take a look for themselves. And what did they find? Hidden away in a dark room were 11 people. Yes. Once they were discovered, the management claimed that they were only there for drink testing. Now, yes, I've translated this several times. I ran it through Google Translate. I translated it myself. Google Translate, and I agreed that it was drink testing. And so they were just testing the drinks. That's why they were there. It wasn't a party. Okay, does that make any sense? And when they were questioned about who uploaded the invitation to social media, nobody seemed to be aware of who did that either. So they referred it to the manager who wasn't aware either. So nobody took credit for this. The people in charge, along with the patrons, were taken to the police station for questioning. Management was fined 1 million rupiahs, patrons were fined 100,000 rupiahs, and Orbit was closed. You can see the police tape up there. An investigation of their license is still ongoing. Whether they're going to lose their license or not is being decided. And more on people not obeying the rules, and just doing some bad things. And this is not bad behaving foreigners. This is a bad behaving Indonesian. An Indonesian Instagram celebrity who I'd never heard of until I saw this article, but apparently she's very famous. Name is Jessica. was arrested along with the event manager of a Nightclub this past week. So apparently Jessica is very famous. She has 146,000 followers on her Instagram account. I guess she talks about makeup, cosmetics. And they were arrested in a villa in North Kuta. Police were acting on a tip about drug use or drug trafficking in a villa. And when they arrived, they found crystal meth in the amount of 4.78 grams. Additionally, a bong, 8 glass pipes, modified lighter, and 2 hand phones were found. And so Jessica and the man, the nightclub manager, were taken to the station where they were questioned and put on display. There's a video online today from the police standing there, and neither of them looking forward, especially Jessica. Their head was down the whole time, and the police were showing off their catch, as they like to do. If convicted, the subjects are up for 4 to 12 years in prison. I don't think Jessica's going to be doing much Instagram posting from there. So I'll see what happens with that case. So last week I said that one of the things that's happening here in order to enforce the PPKM, the emergency restrictions on community activity, was to turn off the lights in public places to keep people from gathering. Well, according to the head of the Bandung Police Department, Robi Septiadi, police are concerned that there's going to be a surge in the crime rate because it's dark, and that tends to bring out criminals, he said. It makes sense. So Pak Robi has asked that the public finish their activities by 8 p.m. when the lights go out, and return home as support for the government's program to reduce COVID-19 transmissions in Bali. And as government officials often say these days in their public statements, he reminded the public that emergency restrictions are not meant to destroy the economy, but rather to protect citizens from virus transmissions. The idea, he said, is to reduce mobility. And he added, for you people that have been driving and complaining about the situation, he added that traffic restrictions have been showing some positive results in reducing activity, although based on some of the videos that I saw today, there seems to be a lot of traffic at these checkpoints, a lot of honking. Boy, I just saw it, and this was down in Denpasar, a lot of people lined up there waiting to go through checkpoints as the authorities check their documents to make sure that they have a reason to go where they're going. And so I saw this, all these motorcycle riders, hundreds of motorcycles, all crammed in next to each other. Does this remind anybody of the fiasco with the Idul Fitri ban in terms of reducing mobility? One of the big questions recently in regards to foreigners in Bali is who gets deported and who doesn't when they violate any of the health protocols, especially the mask protocol. A few weeks ago, the word was that immigration was going to get tough. They were tired of being soft, and they would be deporting people that violated the mask protocol, among other things. And then, like I talked about last week, 3 foreigners were deported, and then others were given a warning or they were fined. So that's been clarified this week. According to Idewan Nyoman Rai Dermati, head of law enforcement discipline for the COVID-19 task force in Bali, it depends on the level of offense. So wearing the wrong type of mask is a light offense, and it gets a warning. And a proper mask, you get a free mask. Okay. Wearing the mask in the wrong way, below the nose, the chin mask, is a medium offense, and it gets a fine of 1 million rupees. While the non-wearing of mask is a serious offense, and it gets deportation, possible deportation. According to Pak Dermati, that's the equivalent of harassing existing regulations. So it seems that more patrols and more monitoring has been going on this week, and more foreigners were deported. In addition to the 3, there were another 2. And at least several dozen other foreigners have had run-ins with authorities, mostly in the Canggu area. There are currently approximately 130,000 foreigners living in Indonesia, and this number varies depending on the source. And a lot of foreigners have been leaving recently, and so those numbers may be going way down soon. So, what do we get from this? Wear a mask, follow the health protocols. Whether you believe in them or not doesn't make any difference. You're here, it's the law, just do it. Okay, so a lot of stories here. Again, the news is unfortunately not really good. What's going to happen? Nobody's talking about opening up yet. That has just stopped. Right now, the central focus is on vaccinations, and the restrictions. The restrictions, emerging restrictions, are the big story. Are they going to continue? You've heard me talk about what the finance minister said about his possible 6 weeks, and then in my first segment about this today, it was 2 weeks, well, another 11 days until the end of the month, and then we don't know. And so we're going to have to wait for that for a couple of days. So if you're looking to travel to Bali, this is not the time. August is not the time. Probably September is not the time. One of the things that's been going on this week, and I didn't really report about this because there's so much other stuff, but the Japanese have left. A Japanese company, I forget the name of it, sent its workers home, 50 workers, and I talked to some friends in Japan, and it was big news there. They said everybody knew about that when I asked them. And Japan was getting special flights to bring all the Japanese citizens that wanted to leave out because, according to news reports, 14 Japanese citizens have died of COVID in Indonesia, and over 300 have been infected, so they want out. And some of our influencers, Instagrammers, YouTubers are leaving as well. Lots of talk, lots of movement on social media about, how do I get out? I want to go home. What do I need to leave Indonesia? How many vaccines? How many vaccinations? What kind of papers? What kind of tests do I need? Where can I fly to? Can't fly to Singapore. So the movement seems to be people leaving, but there are still people coming in, surprisingly. I'm not sure why people would want to come into Bali right now, when we have record numbers every day, when we have restrictions and beaches are closed. Well, most of them, I hear a few are open, but they're supposed to be closed. Can't eat in restaurants. You can't really do much of anything right now, other than sit at home, watch Netflix if you have Netflix, or YouTube, or play with your dog or your cat or whatever pets you have at home, or drink. I'm going to have a drink in a few minutes. And so I'm not sure why people are coming here. I mean, I understand if you've got family, yeah, or if you have a business, but yeah, it's just the island is pretty dead right now. And so unless you have a reason to be here, I would say forget it. Wait until things get better. Wait until things open up. Will they open up next week? Not clear. So, as I've said many times before, if I had a job and I had vacation time coming up and I was going to plan my vacation and I wanted to come to Bali, I would plan it for December, because that seems to be the safest bet right now. Of course, it wasn't that long ago that the government was pushing June and July, and here we are, almost at we're in the middle of July. And July is obviously out, and nobody's even talking about August at this point, other than this report that I had about the president hoping herd immunity is going to be reached by August. So that's the news. Good things. The government is rolling out money. The people in Badung, the Badung Regency, is going to be giving the hardest hit people 300,000 rupiah cash award or assistance, and there's food banks being set up, restaurants, individuals putting food out and advertising it on social media. So you can see, one is that this is pretty severe, and two is that people are stepping up and trying to help out other people if they can. So, sorry that there's no good news again. I hope wherever you are, you stay safe. If you're here in Bali, follow the protocols. Don't go around without a mask on. Don't travel if you don't need to. Let's wait and see what the government's going to do. One of my big things is schools, because my granddaughter is still doing online schooling. So I'm not happy about a lot of this, and I have children that can't get jobs or whose businesses have failed because of this. But we've got to stick together and stick with this until this gets under control. So stay safe, follow the rules, be kind to someone today. Thanks for viewing. See you next time.